He's all the record. It is so important. So
Yeah,
what can I say to you, Dr. Ashish? I call you Ashish there affectionately.
yeah.
So
I will
obviously
also call you as Pavitra
you
because you
call
are
me
just like
Pavitra,
my,
and
yeah, yeah,
you are like my, I should elder brother, or I would say.
yeah.
So and you've been so nice to us as well. So I would just, because it's getting late, just can you give us a small introduction about yourself? Because again, you see, different people are coming from different phases of their life,
Yeah,
and
yeah,
it's so
yeah.
important for people to understand that. I get queries from, you won't believe, from where so many different types of people, different background, and it is only your stories. Unless you tell yourself, there will be so many broken dreams, and your story, like the
Yeah,
ones you
exactly.
saw before, it will put them in the right direction, you see. So please, just give us short introduction about what you are doing, where you are, and how this journey started. Over to you.
Yeah. Thank you, Pavitra.
Yeah.
I am Dr. Asish Bhakta. Presently, I am practicing in a place called Mahishadal, which is very close to the city of Haldia. And I am practicing here for last 40 years. I am a pediatrician and I am practicing as pediatrician here for last 40 years. I graduated from, I got my MBBS from Arjikar Medical College in Kolkata. The same with you.
Same, my college, same is Samud, all same
Exactly.
college,
Yeah.
RG.
Yeah.
Okay.
But my passing out was in 1981.
1981. Okay. I passed out in
Yeah.
92. Okay. So almost 10 years difference. Okay.
Yeah. 10 years. Yeah,
All
exactly,
right.
sir.
Then carry on, please.
So, thing is that after passing my MBBS and completing my house jobship over there, uh, for some reason, for some family reason, I didn't even think of uh, doing post graduation
Good
right
graduation.
then,
Okay.
and I had to, or I was compelled to go for practicing.
Totally.
That was my situation like that during that period. And I
Okay.
started practicing pediatry. I had the background of doing my house jobs in pediatrics under Professor Santindra.
Yeah.
Okay, yeah. So, but the thing is that the practice turned very much favorable for me. And within a year, I developed a huge practice. A huge means huge. It
I can only
went.
guess.
I can only say, please don't think
No, no,
I'm
please tell
boasting
how
of
many
myself.
percent. No, no, no,
Yeah,
because we need to know. You see, so many people are there. We
exactly.
need to
I
know.
started seeing more than 100%, sometimes 120% a day
Oh my God. Within 1 year,
within 1 year.
you are really
So
blessed.
at that time, I met Professor Indro.
Okay.
I said, Didi, should I go for postgraduate entrance examination? So Didi said, how much are you making?
Uh,
I said, I am seeing
and
more than 100 patients per day, but uh, I am making less because my fees in the rural
yeah,
area is very less.
yeah.
So, yeah. So she said, Ashish, you don't go for post graduation right now because you have started earning a lot of money. You won't be able to concentrate in studies again.
Okay.
I just obeyed her.
Okay.
But I had the dream,
Yeah.
truly speaking, not of post graduation in any area, but I had the dream of becoming one member of Royal College of Physicians in UK.
Okay. So this was right from the beginning. You had this dream, long
That
time.
time it MRCPCH, yes, that time only with pediatrics as a special paper, yeah. And
Yeah.
Professor Indra was
Earlier,
also MRCP, later on
yeah,
CB,
yeah.
FRCP.
Earlier it was
So I
only
had
MRCP.
that dream.
Yeah.
Yeah, yeah. But I had that dream planted in my brain.
My God.
Though I expressed my desire to my missus.
Okay.
And truly speaking, without her and without your assistance, probably I could not have finished I could not have reached my dream.
That's your good, kind words, basically. But anyway, so how did you come to know about
So
us,
that time,
Ashish?
and she did a lot of
Mm.
sacrifices for me. That I am, yeah. I came to about you from my friends.
Okay.
One is Dr. Tomal Laha, he was also
Ah,
with you.
yeah, yeah, yeah. We know him very well.
Hello,
Yeah, I can hear you.
hello. Yeah,
Can you hear me? Yeah. Mm.
yeah. I came to know of Dr. Academia from Dr. Tomal Laha,
Okay.
and he also cleared his MRC clinical from Dr. Academia.
Yes,
and
you did.
he's also from the same institution as you and me, and
From RG. Oh,
4 years junior to me and 6 years senior to you.
okay.
Tomal recommended me, Asisda, and he and Dr. Anjan Bhattacharya gave me your phone number.
Okay. All right.
Phone, and I said I have got your number from Dr. Anjan Bhattacharya and Dr. Tomal Laha, and I want to be enrolled with you for finishing my clinical examinations. So
Okay.
that was the start of my,
So which year was
clinical
it?
journey.
Yeah,
Before
so
that, I finished
your
all
theory
the
already.
examinations.
Yeah, yeah.
And truly speaking, I started pursuing MRCPCH, I mean, 2014.
Okay. So
But
that's
at
when you
that
started doing the
time, I
theory.
had a big health challenge.
Okay.
Uh, I had to my body. I
Okay.
used to smoke,
Okay.
and I had to give up my desire at that time.
Okay.
And I went. Surgery was done on me, and thereafter, I somehow I was so confident I will have to come back, and I came back.
Okay.
I
I
came
got
back,
it.
started again. Then
Okay.
in 2018, I cleared, and I mean FOP and disease clinical examination, and thereafter I cleared. Yes, thereafter I cleared this. And AKP, I took some time because that was COVID time.
Yeah.
So examinations regularly being, and I didn't like this. I mean, appearing in the examination from my home or etc. These alternative options were
Yeah,
there,
yeah,
but
yeah,
I
yeah,
didn't
yeah.
like them.
Yeah.
That's why I was waiting for COVID to go. Yeah,
Okay.
and then I appeared for AKP. I cleared it, and then the came a clinical first time for me, but I failed.
Yeah. When was that? When I just remind
That
me?
I had to make up, and you are the people who helped me to. Um,
Yeah. Which month was it you gave the first time? Just remind me. 2020,
so one
23.
in one station I got zero. It was in 23. Yeah,
Yeah.
it was in 23. Not in 22 September,
Okay.
and in 23 I passed the exam.
Okay. Okay. So what was your reason why there was some challenges? Which was your main challenge for the clinical exam? What do you think was your main challenge?
Yeah, before clinical, what happened? You see, I had melena just 6 weeks back. 6 weeks before the clinical exams, I had melena, uh, bedridden for a week.
Okay.
And what happened after I was just getting better. My daughter suffered from meningitis,
Oh
and
my God.
she
Oh,
had to be admitted to MRI hospital, and I had
oh,
to spend long 15 days there at the
oh my
MRI
God.
hospital without any studies.
Oh,
So at that time, I got mental support from you. I also called you and Urmila. And Urmila just, she told me, Ashish, you decide, either you face it or you withdraw. There are options. I will help you. I said, okay, give me some time. So within a week, I decided, no, whatever happens, I will face the exam,
okay.
because Pavitra, my nature is I do not want to surrender to any situation.
Okay. You don't
So
want to give up.
I thought 15 days. Then I had only 15 days time in my hand,
Oh my God.
but I got enough training from your side, and I just started. I withdraw myself from practice for last 15 days. I
Okay.
stayed in my flat in Kolkata,
Yeah.
and I just detached myself from everything,
Okay.
and I went on studying I am listening to the lectures that I had
The videos,
from
were you seeing the
you,
videos? Yeah.
and
You-
finally I was confident.
Okay.
Yeah, exactly.
You saw the videos. Okay.
And finally, I was I had the confidence that I to keep up my confidence. What I did in the before the exam, that I started thinking that this is just my clinic. Each and every
Absolutely.
station, and I will be facing the patient with sitting beside me, and we will be discussing the thing over a
Okay.
period. So
Okay.
that gave me extra confidence.
Okay. So you felt that as if you
And
behave as if you're
one
doing
thing
a
I
clinic.
did, I
Hmm.
must, at is it is my own clinic.
Okay.
So that relaxed me. And
Okay.
I did one thing. The head examiner, I
Getting some disturbance. Sorry.
stood up, went to with him and said, "Sir, I know you because I had seen you previously in Nepal." And he was so cheerful and he greeted me.
Okay.
Oh, oh, that's fine. And I hope this time it will be better. I said, "Yes, of course, I also hope so." So that gave me a booster.
Okay.
I talked to the head examiner, you know who he was,
Yeah, yeah,
and
yeah.
he just encouraged me, and I started my examination. I
Okay.
did well in each and every station.
Very good.
I got 76 out of 80.
My God. Great.
Right.
Right, right. And we know how it is for you, especially. So again, I wanted to say congratulations on this recording because even though we communicated, but saying face
Thank
to
you,
face,
thank you,
that is
thank you.
so
Yeah.
big for you. I think what I'd like to hear from you is what is
Yeah.
your advice to so many doctors who, for various reasons, at the peak of their life, when they have done the MBBS,
Hello.
similar to you. Can you hear me, Dr. Ashish? Because
Hello.
can you hear me? I think there is some
Yeah, yeah,
problem
now
with
I can hear you.
because just check your communication because sometimes the
Sometimes my
connection
Wi-Fi yeah.
is not doing well. Okay, so
Uh,
so I'm just asking you one question. What is your advice for those?
disturbing. Yeah.
Can you hear me?
Oh, yeah. I can partly hear you, but the main thing is that what is my advice or suggestion is
Yeah,
that
to other doctors.
the
Yeah,
whole thing is about the whole clinical examination. Yeah. The whole clinical examination is about your art of communication. Be it
right.
the clinical stations, be it the history taking station, be it the development or the communication or the video station. You are always communicating with someone. It may be your examiner, it may be the patient, it may be the patient party, but you are communicating.
Mm,
Communicating, your way of talking to the examiners, everything matters.
mm,
So that must be very professional and very polite. I said the word very polite.
absolutely.
You have to be, because I missed the first exam because I could not, I was not submissive in one station. I
Okay.
was very rigid about my decision, and that I later on I understood I am not bigger than the examiner.
Okay.
So when sometimes examiner says, "Is there any other option?" means there is something else
Yes.
that the
Yes.
examiner is
He's
wanting
trying
listen
to
from
help you.
me.
Yeah.
I
He's trying
must
to
not
help you.
argue. Yeah,
Absolutely.
he is trying to help me, but
Yeah.
I did the mistake that I argued. No, this is right. What I am saying, and that was wrong. That is the
That is a
wrong
mistake.
way of facing examination.
Okay.
Everybody must be careful about submitting to the examiner, because the examiner always, it is taken for granted that knows much more than the candidate.
Right. So thanks so much. Thanks
Okay,
so much.
Pavitra?
Thank you so much.
Yeah.
That's already almost 10:40. Thanks for, I know you are also at the end of a busy day. So
Yeah,
many,
yeah, yeah. Thank
seeing
you.
100 patients and you've got the energy to talk to us.
Yeah.
I think you are an inspiration for a lot of us because, sometimes I feel that I've become so old now. How much to do? But looking at you, I feel that, and the main thing is not just our practice, about how high our practice from you and Dr. Shaborni. It's not only about getting a fancy, UK degree. I know there's a prestige to it. And not only, as I said, about getting a lot of respect
It
from your
is, it is,
colleagues.
it is definitely a fancy degree, Pavitra. But
Yeah,
the
it is
thing
a
is
very
that,
prestigious degree, but something more than that. You did not do only for that, is it?
yeah,
Even Shabuni, there was a higher, more noble
it is,
purpose. There was a more
it
noble
is a
purpose.
requirement. a doctor should have one UK degree to become a complete doctor.
Yeah. And I think the reason for that is more than the fancy title is the other things which we are lacking in our Indian system, which is the empathy, the
Yeah,
communication part.
exactly, exactly,
That
exactly.
that is what makes you complete. I would compare it, our education, to like a, like what we say, iceberg, where on the tip of the iceberg is the diagnosis, the treatment, clinical science, where
Exactly,
underneath it is a lot of hidden, social situation, what is happening at home, what is the economic situation, what is the home condition, which here we never talk about that. And sometimes a lot of the
exactly,
clues are
exactly.
there which we need to look at. So thank you so much. And we will be in touch with you because we will be inspired
Sure,
by you.
sure, sure.
And I hope this video reaches a lot of other doctors who are in similar situations, that they will be inspired by your journey. Thank you so much. So with that, I'll
Thank you,
take your
Pavitra.
leave.
Thank you.
I'll just end this recording here. Thanks so much.